Doctor, spinal ligament injuries are the most significant injuries the spine can have, and damage to the non-disc ligaments are some of the most problematic injuries in the market today. Now, some of them, and a lot of them, a lot more than what you think, are going to qualify for spinal fusion guidelines. Now, let me show you exactly what I mean. Take a look.
Now, if you look at this report says that we have an angular ratable finding. So in surgical guidelines, anything that's ratable is generally a pre-qualifier for spinal fusion surgery. Now, does that mean you have to send the patient out for a spinal fusion consult? No, you have to make that decision. No one can tell you what to do because we are not there seeing the patient. We're not with the patient. We don't know what the signs and symptoms are. We don't know what the particulars are with the patient. But what I am saying is the beautiful thing about a CRMA report is the consensus around how serious these injuries are. That's the thing that I want you to be the most impressed with. And when I mean impressed, I mean I want it to have an impact on you, to know that this is how serious of an injury that you're actually treating on a regular basis and probably have been for your whole career. So if you look here, it says, hey, this is the determination and medical necessity for the performance of spinal fusion. So you have to have a criteria in order to get pre-authorization in general healthcare for spinal fusions. And it says, hey, if I got any of these flexion extension radiographs that demonstrate instability that include any of the following. Now, the 3.5 millimeters, that's 5th edition alteration motion segment integrity. The 20% sagittal plane is 6th edition translation findings, and the 11 degrees is both 5th and 6th edition. So let me show you a resource where you can get even more of this. Okay, again, we're at the Spinal Kinetics website. If we just actually go resources and we go surgical guidelines, you're actually going to see the same surgical guidelines that I just showed you. You're actually going to see the same reference of what I just showed you. And then you're also going to have, you're going to see links to where these are so that you can pull these up. Again, all we're showing you is the significance of the injuries that you're treating on a regular basis.